Welcome to this video. My name is Joseph. I'm a psychiatrist working in Western Australia. We're a group of psychiatrists and psychologists here at ePsychiatry who practice primarily by way of telehealth. Today's video is on surgery and how it can affect one's mental health. It is inspired by the experiences of a client of mine recently. There are timestamps here as a guide. Surgeries can happen for all sorts of reasons. Sometimes it's well planned in advance, such as when you have your knee replaced or cataract surgery. Other times it happens in a rush, such as having an appendix or a newly diagnosed breast cancer removed. What are some of the things that factor into how surgery affects us? There is our own personal makeup, what's going on in our lives, stresses and supports that we may or may not have. Added onto this are past experiences of surgeries, be that first-hand experiences or that of others we know. There's also the experience we have with our surgeon, the nurses, our anesthetist, which affects our stay at the hospital and the memories we take when we leave. Let's discuss two examples. Firstly, Anne, she's in her mid-50s, diagnosed with breast cancer following a routine mammogram. She is devastated by the news and is highly anxious about the prospect of surgery. However, she understands that the proposed surgery is potentially life-saving. Fortunately for Anne, she is well supported by her adult children and has a wonderful surgeon who answers all the questions she has and walks her through the proposed treatment. Anne is fortunate. She is at the stage in life where her finances are secure and she has sick leave up her sleeve. Whilst Anne has a history of depression, which predisposes her to another episode, plus she's facing a very serious illness, what might reduce the risk of a relapse of her depression are the factors that I mentioned just earlier. Next, let's take John, who is in his early 30s and suffers from a burn at a mine site. He's rushed to hospital and has a skin graft done, which goes on to have complications, and he needs another surgery. He's away from home in quite a bit of pain and struggling to sleep in a busy hospital ward. John has always seen himself as someone who is fit and healthy. His repeated surgeries have shaken his confidence. The word surgery carries with it stigma and a heavy weight. Sometimes having an underlying mental illness can make the journey through surgery more complex. We believe that mental health both prior to and post-surgery should be looked at. Sometimes all that is needed is good supports, a thorough explanation of the process, and a time to digest it. Others may want to speak to someone to help them overcome their anxiety or changes in mood. For a small subset of the population, the prospect of surgery can leave them putting it off, which may adversely affect their longer-term health. These people may benefit from seeing a psychiatrist or a psychologist alongside their local family doctor. Thank you for watching this video. If you'd like to know more about surgery and mental health, visit our website. We put out videos almost weekly. The next one is on a very different topic. It's about preparing for exams mindfully.